You are listening to Stranger Than Fiction, Corruption and Crimes Against Humanity in the COVID Era, an audiobook by N.B. Austin. Chapter 2, Lockdowns and Business Closures. This is a free audiobook, but if you enjoy what you're listening to, you'd like to cut ahead quicker, you want to have access to all the citations, it's also available in ebook and paperback on Amazon. Even if reading is not quite your thing and you prefer to listen, buying a copy would be a great way to support and is much appreciated. Now, without further ado, let's begin. Quote, "That's something that I don't think we could possibly do in the United States. I can't imagine shutting down New York or Los Angeles, but the judgment on the part of the Chinese health authorities is that given the fact that it's spreading throughout the provinces, it's their judgment that this is something that in fact is going to help in containing it. Whether or not it does or not is really open to question because historically when you shut things down, it doesn't have a major effect." End quote. Anthony Fauci, January 24, 2020. Quote, 15 days to slow the spread. End quote. Anthony Fauci and Trump administration COVID plan, March 16, 2020. Quote, "If you look at the trajectory of the curves of outbreaks and other areas, it's at least going to be several weeks. I cannot see that all of a sudden next week or 2 weeks from now, it's going to be over. I don't think there's a chance of that. I think it's going to be several weeks." End quote. Anthony Fauci, March 20, 2020. Quote, "So if we can get the overwhelming portion of the population vaccinated by, let's say, the end of the second, the beginning of the third quarter, by the time we get into mid-fall of 2021, we can be approaching some level of normality." End quote. Anthony Fauci, December 16, 2020. Quote, "By the end of the year, by Christmas." Anthony Fauci, February 19, 2020. Quote, "If all things go the way we want them to go, and we really get the overwhelming majority of the people vaccinated, I think as we get into the fall and winter, we could start to really get some good control over this as we get back into the fall of 2022. End quote. Anthony Fauci, August 23, 2021. Quote, "When I listened to the tape, I meant to say spring of 2022, so I did misspeak." End quote. Anthony Fauci, later in the day of August 23, 2021. In March of 2020, by the sudden orders of public health officials around the world, society as we know it shut down. Small businesses were deemed non-essential and ordered closed. People were told to remain at home, with non-compliers in some particularly tyrannical places facing financial and/or criminal punishments. Masks were mandatory for customers to attend stores, with non-compliers refused service, and mandatory mass testing campaigns took place to attend workplaces, among other venues. These extraordinary actions were taken in the name of a cluster of patients suffering from pneumonia-like symptoms in Wuhan, China. Those patients were ultimately alleged as having contracted a novel coronavirus, which would go on to be referred to as SARS-CoV-2. The diseases this virus caused would be referred to with the name COVID-19. This is the highest level of the COVID-era story. There is much more background to every narrative told, every action taken, and every player involved if one wishes to understand what actually happened in 2020 and the years that followed. This book will provide as much of this background as humanly possible. For now, however, we will start with one of the most jarring, pandemic-defining actions for many people, lockdowns. So where did this idea to quarantine the entirety of a population come from? Was it a visionary in epidemiology? Was it the result of a successful disease-mitigating experiment? No and no. As shocking as it may sound, the idea of lockdowns and closures as a strategy for pandemic mitigation originated from a 14-year-old girl's science fair project. Per TV personality Dr. Drew Pinsky, her project led her computer programmer father to model out such a scenario. According to Pinsky, quote, "He and she then published a paper in 2006 that the Bush administration adopted as policy." The unprecedented approach taken by public health organizations in 2020, however, was this young girl's recommendation of regional sorts of closures on steroids. And countries like Australia are a shocking example where people have been violently arrested for having, quote, "no valid reason to be walking within a few hundred feet of their homes." Even if we look past the inhumanity of such a situation, it would be reasonable to wonder how the physical interaction of a group of officers detaining a person who is minding their own business is anything but counterintuitive, especially if the stated goal is keeping humans distant from one another. One might even question how slamming a man on the floor for eating a sandwich outside is contributing to his health and or teaching him how or why he should be complying with unlawful orders. During our time, we did question these things, as we saw a variety of such events captured on video. Some of the officials responsible for these enforcement actions, like Australian Prime Minister Scott Morrison, for example, even admitted such policies were, quote, not a sustainable way to live in this country. But reason and decency were simply not a consideration or limitation when it comes to public health organizations in the sweeping megalomania of 2020. Before we continue with the unfathomable, perhaps unintended consequences, however, we can start with the most obvious, necessary question related to these public health organization lockdowns. Did these measures work? The answer is that they observably and objectively did not. A January 2022 meta-analysis preprint by a team including a Johns Hopkins economist, for example, concluded the following on the matter. Quote, while this meta-analysis concludes the lockdowns have had little to no public health effects, they have had enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. End quote. As we saw in the opening quotes, Anthony Fauci said in January 2020 what Johns Hopkins supposedly discovered 2 years later, namely, that locking down, quote, doesn't have a major effect. However, Fauci's pronouncement came just before the U.S. went on to engage in an unprecedented lockdown effort, without any resistance from the head of the U.S. pandemic response. In fact, as we saw in the subsequent quotes, Fauci exploited the public's trust in extending his planned 2 weeks to slow the spread further and further. But Fauci wasn't remotely alone in this behavior. Throughout the COVID era, the opinions of, quote, experts like Fauci were deemed infallible to the point of being worthy of human rights violating enforcement. And lockdowns were but one example of the complete lack of benefit those opinions provided to the public's health. So why did lockdowns happen anyway under the watches of such prominent public health officials? Why did many of them support the lockdowns? And why didn't the rest openly and aggressively oppose something so fruitless which would also have significant consequences? We will discover the answers over the course of this book. But the truth is that lockdowns didn't just have, quote, little to no effect on public health, but rather an overwhelmingly negative effect. In fact, across the entire world, the countries and states with the harshest lockdowns tended to experience the most cases and deaths. Per Johns Hopkins, the following are the top 3 countries to date by deaths classified as COVID per 100,000 population to date as of September 2021. Number 1, Peru, 611 deaths per 100,000 population. 2, Hungary, 308 deaths per 100,000 population. 3, Bosnia at 300 deaths per 100,000 population. The COVID-19 Government Response Stringency Index is a composite score ranging from 0 to 100 developed by researchers at Oxford University. This index was put together to track the stringency of public health policy measures implemented by countries, including school closures, business closures, travel restrictions, etc. For each of the 3 countries with the most COVID-classed deaths per capita, we will now review how restrictions over time impacted case and death rates. 1. Peru. Peru's stringency index score was greater than 75 from mid-March through mid-December of 2020. For the majority of those months, it reached and remained greater than 90 as one of the harshest countries in the entire world. It was also one of the first to eclipse a score of 90, doing so on March 16, 2020. Despite having reached this level of lockdown by March 16, Peru did not register its first COVID-classed deaths or cases until a week later. From that point on, cases climbed throughout the year despite all restrictive efforts. After a brief week or so of respite in December, measures soon tightened again in 2021 to 2020 levels, with cases and deaths following suit. The bottom line is clear. Peru at the same time had some of the strictest measures taken in the world and also experienced the most death per capita in the world, clearly demonstrating that the measures were an abject failure. 2. Hungary. Hungary is an interesting case because it remained largely without COVID impact until the winter of 2020. However, it too demonstrated the same story as Peru as far as lockdown effectiveness is concerned. Like Peru, Hungary eclipsed 70 on the strictness scale prior to registering a single death or case. It then experienced a small cluster of deaths and cases, which lasted until measures were reduced in May. Restrictions, cases, and deaths then vanished until fall of 2020. In the fall of 2020, cases and deaths began to rise, and with them so did restrictions. Hungary soon topped the 70th percentile of the index again, where it remained until mid-April 2021. At this exact time restrictions eased, cases and deaths both dropped off a cliff until today, September 2021, when Hungary is one of the least impacted and least restricted nations in the world. Bosnia. Bosnia shows the opposite of Peru and Hungary, as it progressively decreased restrictions over time and experienced the same waves of deaths and cases as other countries. With no cases or deaths to start with, this country still implemented intense measures, with upticks in incidents soon to follow. It remained at a score of 50 leading into its first major spike. From there, as measures eased, spikes up and down continued. If nothing else, Bosnia shows the complete lack of correlation between measures and outcomes, both in its timing as well as when compared to places like Peru and Hungary. In reviewing those with the top death rates, we can clearly see these countries were provided with no benefit whatsoever by lockdown in general or by mitigating inevitable case spikes. To round out this review, though, let's look at some of the least restricted countries. Belarus, per 100 death rate, 41. Restriction index never went above 50 from the beginning of the pandemic to date, and averaging around 30. Sweden, per 100 death rate, 143. Restriction index never went above 70 from the beginning of the pandemic to date, averaging around 50. Finland, per 100 death rate, 19. Restriction index max of 71 for 2 weeks in April 2020, but averaging around 40. These figures are simply not explainable if lockdowns work. The countries with the harshest restrictions during timeframes with no known treatments very frequently saw more per capita deaths. And as we can see in the above examples, countries with far less restrictions did not show any clear evidence of worse outcomes. In fact, the empirical evidence seems to point pretty clearly to restrictions actually worsening mortality rates attributed to COVID. Despite COVID-era claims to the contrary by the U.S. Centers for Disease Control and Prevention, the CDC, the National Institutes of Health, the NIH, the mainstream propagandist media, and the mainstream propagandist social media networks, this issue was also hotly contested by thousands of doctors and scientists the world over. Such alternative doctors posited that avoiding human contact, locking people indoors, increasing fear, and otherwise diminishing human productivity is the opposite of a public health strategy. In fact, 14,879 medical and public health scientists and 43,804 medical practitioners signed a public health declaration affirming their opposition to the draconian actions taken by public health organizations since the beginning of the pandemic. The Great Barrington Declaration, as it was titled, called instead for a strategy of focused protection for the at-risk populations which desired it, without sabotaging the lives and medical autonomy of those not at risk. The declaration was inexplicably ignored by the aforementioned U.S. organizations, however, despite its clear, previously demonstrated success in places like Sweden. And so too were the pleas ignored of even those government officials dissenting from the narrative. One such example is former White House senior health advisor Dr. Scott Atlas, who criticized Fauci, COVID response official Deborah Birx, and CDC Director Robert Redfield for refusing to look at scientific data pointing to the futile, harmful effects of lockdowns. Atlas recalled his time addressing these figureheads on the matter as follows, quote, "As I finished, there was silence. No one offered any contrary data. No one spoke to scientific studies. No one even mentioned the discredited Korea study. Zero comments from Dr. Birx, nothing from Fauci. And as always, not a single mention by Birx or Fauci about the serious harms of school closures. In my mind, this was bizarre. Why was I the only one in the room with detailed knowledge of the literature? Why was I the only one considering the data on such an important topic with a critical eye? Were the others simply accepting bottom lines and conclusions without any analytical evaluation? Weren't they supposed to be expert medical scientists too?" End quote. Atlas goes on to claim the only responses he did eventually get from the trio in question were empty slanders. He quotes Birx as having said his data and assessments of it were, quote, out of the mainstream, accusing him of being, quote, fringe and uttering the blatant lie that, quote, all experts agreed with her. This lack of scientific justification is particularly damning when considering the extent of the economic and social consequences associated with the ends justify the means approach lockdowns constitute, for which the ends are either a zero or outright negative benefit. Those consequences have been widespread and are now well-documented history as follows. 1. Violation of basic human rights, including the right to peaceable assembly, the right to free religious worship, the right to free speech and expression, the right to seek redress of government, and the right to informed consent. 2. The surrender of the legislative authority and responsibility of elected leaders to public health officials so long as they declare emergency. 3. Per a 2021 study by Rahman et al. In the British Medical Journal, the BMJ, the lockdowns had a, quote, significant negative impact on health and provision of healthcare. The study's multivariable analyses showed that all 5 dimensions of healthcare provision reviewed, non-affordability, non-accessibility, inadequacy, inappropriateness, and discontinuity of care, were negatively affected. Associated depression and social loneliness were also observed outcomes of the analysis. 4. One example of the aforementioned outcomes includes the negative effect of lockdowns on healthcare outcomes in the UK, where a report concluded up to 740,000 potential cancer cases that should have been urgently referred by physicians have been, quote, missed since the first lockdown. Another report claimed that official data showed, quote, 1 in 10 people in England found themselves on waiting lists for various operations, with suspected heart attack victims waiting almost an hour for ambulance care and more than 300,000 patients waiting over a year to receive care. 5. Per Federal Reserve estimates, the pandemic response resulted in the permanent closure of roughly an additional 200,000 U.S. establishments compared to normal levels. 6. Australia, among other countries, developed camps for concentrating its citizens referred to as quarantine facilities. There is without question no benefit this provides whatsoever. It is slavery and is reminiscent of the most evil periods in human history. 7. Per Human Rights Watch, quote, Sri Lanka's police are increasingly killing and abusing people under cover of the COVID-19 pandemic measures. End quote. This abuse of power is not isolated to one country, however. Per Amnesty International, at least 60 countries demonstrated documented cases of, quote, authorities adopting punitive or coercive measures which have not only resulted in violations of human rights, but also divided societies and failed to tackle the health crisis, end quote. Cited violations include arbitrary arrests, unlawful use of force, crackdowns on criticism of pandemic response, and torture. 8. Per World Health Organization's Dr. David Nabarro in October 2020, quote, we really do appeal to all world leaders. Stop using lockdowns as your primary control method, end quote. Some reasons cited included the destruction of the Caribbean tourism industry, difficulties for farmers and food supply risk, world poverty doubling within a year, and the doubling of child malnutrition. Despite pleas of this World Health Organization expert, lockdowns around the world did not stop. Even Western countries like New Zealand went on to senselessly enforce strict measures over a single case. 9. Per analysis by research group Collateral Global, 1.2 million children worldwide could die from disrupted healthcare and pandemic lockdowns. This is more than a quarter of the total deaths worldwide attributed to COVID as of the fall of 2021, and only addresses the impact of disrupted healthcare on one demographic, namely children. 10. Per a 2021 study by Hill et al. In Pediatrics, youths demonstrated a higher incidence of suicidal behavior during the 2020 COVID closures than in 2019. To be clear, this is a group with effectively no COVID risk whatsoever, seeing as only 412 total deaths were attributed to COVID under age 17 from January 2020 to September 2021. By comparison, there were 924 pneumonia deaths in the same time period in the same age group. 11. Per the American Institute for Economic Research, the increase in youth suicide deaths dramatically outpaced those attributed to COVID. A review of CDC mortality data showed a 23% increase in deaths of all causes in the 0 to 24 age group from 2019 to 2020. And while one might wish to associate this increase with a horrific COVID death toll, COVID-attributed deaths accounted for only 1.2% of the total deaths in this age group. Based on previously mentioned studies affirming malnutrition, interruption of healthcare, obesity, suicide rates, and depression in this age group, this staggering increase can therefore only be attributed directly to the clearly misguided responses of public health organizations. And to put the death toll in context using a simple calculation, the U.S. under 25 population is approximately 30% of the approximately 330 million U.S. population. This means there are approximately 99 million people in this age bracket. So with a per 100 all-cause death toll rate in 2020 for this age bracket of 131.7, a total year-over-year increase of 23, minus a COVID-associated rate of 1.2%. This means the incremental increase in death associated with public health malfeasance is 28.7 per 100,000. Finally, with 99 million people in this age bracket at a rate of 28.7 per 100,000, this would mean approximately 28,400 children ages 0 to 24 were lost due to the effects of public health malfeasance of various forms. 12. Per a 2021 study by Wolford et al. In the Journal of the American Medical Association, JAMA, childhood overweight and obesity saw a relative increase of 23.8% during the pandemic when compared with a reference period. According to Mayo Clinic, obesity is a risk factor for serious symptoms of the diseases called COVID. This implies the actions taken worsened the danger. 13. Per the United Nations, drug abuse increased 22% worldwide during the pandemic. 14. Per the International Labor Organization, workers lost $3.7 trillion in earnings during the pandemic, with women and young people hardest hit by the employment losses. 15. Per Oxfam, the world's billionaires made $3.9 trillion during the pandemic. 16. Per census data, the number of Americans who say they can't afford enough food for themselves or their children is growing, caused by school closings, inflated food prices, and inability of government to fund continued jobless benefits without increasing inflation even more. 17. A 2020 study by Silverio Murillo et al. In the SSRN Electronic Journal analyzed data from police precincts in several major U.S. cities. It found domestic violence increased by 10 to 27% during the lockdown periods. And 18. Per the Mises Institute, the CDC, operating under the U.S. Department of Health and Human Services, DHHS, has asserted jurisdiction over private residential leases nationwide. The CDC has taken this absurd action, for which it has no real authority, in the name of curtailing evictions related to the economic impact of lockdowns it is responsible for encouraging. Not only is this a tremendous perversion of U.S. government authority as a whole by an unelected bureaucracy, but the impact of these eviction moratoriums will continue to have further negative impacts economically on private landowners, who amid skyrocketing home prices will continue to be outbid by large, favored debtor private companies. More on this in a later chapter. These damages and their psychological effects were also dragged on with no specific adhered to objectives or goalposts. As we showed earlier, Anthony Fauci's disorientation was one of the most evident examples of this aimlessness. When combining the shocking amount of devastation resulting from the lockdowns with their way less than zero positive impact, it is clear that the organizations responsible utterly failed in their mandate to, quote, control disease. In fact, as demonstrated, their actions contributed greatly to senseless suffering and increased disease, and will continue to well into the future.